In Health Watch today, new hope for the 1 million Americans with type 1 diabetes. It's a promising treatment pioneered right here in Chicago that uses patients' own stem cells. Health Watch reporter Nasita Kwan's got more on this. This is huge news.
It really is. Let me first do some explaining, though. In type 1 diabetes, the body no longer makes enough insulin, the hormone that regulates sugar. So patients have to take insulin shots just to survive. Well, this new study says some patients may be able to boost their body's natural insulin factory. It's the first study that uses patients' own stem cells to do it. Life can be a serious fight for patients with type 1 or juvenile diabetes. 15-year-old Kim Black was diagnosed when she was just 5 years old.
I have to think about it like 24/7 all the time, like when I'm going to eat next, where I'm going, and if I have to bring a test kit, and how much insulin I have to give myself.
Most experts believe diabetes develops because the immune system malfunctions and starts attacking special cells in the pancreas that make insulin. Diabetes can destroy 80% of these islet cells by the time patients are diagnosed. Now, a new treatment featured in the Journal of the American Medical Association may stop the body from killing islet cells. Northwestern University's Dr. Richard Burt led the research on 15 diabetics in Brazil. He gave those patients a new immune system by using their own stem cells.
He said, let's make a new immune system from your own, the patient's own adult immune cell, but do it early enough when there's still, we know, some islet cells left, and see if they'll regenerate and recover and the body will heal itself.
First, they harvested the stem cells from the blood. Then the stem cells are frozen, and doctors destroyed the diabetic's old immune system with chemotherapy.
And we infuse your immune stem cell back in, and it makes or regenerates a new immune system.
One participant had complications, doctors think, from a steroid medicine.
It worked very well in those next 14 patients, and the majority of them became insulin-free shortly after the procedure.
13 patients still don't need insulin up to 3 years later. And the great thing about using your own body stem cells is that there's no danger of rejection, so patients don't have to take those anti-rejection drugs that may have some serious side effects, Marion.
That's amazing.